There we go. Okay, we've got someone. Don't know if you were here before, but I just had to stop to charge this, so sorry about that. Yes, so I am Rachel. I am currently in a mental health clinic in Australia, and I just thought I'd have a bit of a chat. I did do a stream yesterday, and that was pretty cool, so I thought, yeah, may as well see how it goes today. If you guys have any questions, let me know, and I will be more than happy to answer them. In the meantime, I'll just sort of explain myself. So, yeah, I'm Rachel, I'm 27, currently in a mental health clinic in Australia. I'm primarily here for depression, OCD, and anxiety. Although I do also struggle with anorexia. So, I've had anxiety all my life. I was a really anxious kid. Okay, we've got this chat going. I'll just get to it a second. Yeah, I suffered from anxiety from when I was a kid. Then depression cropped up when I was 10. OCD cropped up around that time, and developed anorexia at about 14. All of them have fluctuated throughout my life. And it's ramped up really during the past 5 years, and so since then I've actually been in this clinic a number of times. So yeah, let's get to it. Doing okay today? Oh, thank you. Really nice question. I'm okay. You know what? I'm doing okay. Like everyone else, I'm just plodding along. We're in some pretty weird times. Oh, good to see you. Oh, Granger. Yes, love Harry Potter. I remember you. Nice chatting with you. Yeah, so how are you guys going? I hope you're all okay. Yeah, so during these times things are a bit weird. A question I actually got a lot yesterday was, are you allowed out, and how are you allowed phones and that sort of thing? Usually we are allowed out. We can sign out as we want, come back as we want, depending on what category of patient you are. So when you first come in, you're a category 3, which means that you can't leave. When you're a category 2, I believe it's leave for up to an hour or something like that. I can't really remember. Category 1 is, yeah, you can leave when you want, come back when you want. Hey, good to see you. Good to see you too. Thanks for the comment. Yeah, you can leave whenever you want, come back whenever you want. As soon as it's between certain times of day. So, for instance, when I first came in 2015, I was in for electroconvulsive therapy for major depression. That's a whole different thing, and it's actually a good treatment. What is depression? There is something wrong, but okay, good question. So, depression, there's a lot of misconceptions about it. A lot of people think it's just being sad. It's not true, and everyone experiences it a little bit differently. For me, I describe it as wearing these grey glasses. Like, you know how people say rose-coloured glasses? Well, for me, it's like grey-coloured glasses. Everything is coated. During my times when it's really, really bad, it's like there's just this shadow around me. And for me, it feels really, really cold and icy, if you can imagine that. It feels like no one can really get in. Like, people will talk to you, and my wonderful mum, my amazing mum, will hug me, and usually that's such a wonderful feeling. And it is a wonderful feeling physically, but it's still kind of like it just doesn't get in, and you just feel so alone and so small, and it's really, really scary. It's really, really scary. Can it be temporary? Only last a couple days. Sometimes are great, but others get so low. I just want to say before all of this that I'm not a physician. All of my knowledge comes from reading the DSM, from my own research, and from a few courses I did in university. I studied biomedical science, but I am by no means a professional. Please, if you are struggling, go and see a professional. They're the ones who are qualified to help you. So can it be temporary? I believe in the DSM, it's the symptoms have to last 2 weeks. So there's this list of symptoms, and I have, yeah, I think it's 2 weeks, and it's. Look, I'm sorry, I could be wrong. I don't actually have the DSM in front of me. I will have to get it brought in. I do have it at home. Yeah, I believe it's 2 weeks that they put there. But yeah, it's just this list of symptoms. In terms of some days feeling great, others feeling low, I'm not sure about that. I don't want to throw any more diagnoses at you and say, you know, it could be this, because again, I am not qualified to do that. But please, if it is bothering you, and it sounds like it is, if it is bothering you, please see someone, because you are worthy of help, and help is out there. My girlfriend broke up with me. Oh, I'm so sorry. You've been struggling these past weeks. I'm so sorry. I know what heartache is like as well, and it is such a hard time. You really have to find what helps you to get through it. So, you know, it might be a distraction. Sometimes we do need that period to grieve, and just be in it, maybe listen to some cathartic music or something like that. But yeah, you really have to find out what works for you. So I am really sorry for your position, because it is so hard. And yeah, good luck to you. Good luck. Thank you for chatting. Oh, I'm really glad. Hey, Slender Man. Oh, okay, nice. Thank you. What did you like for fun or joy? I love playing the saxophone, alto saxophone. I love music, absolutely love music. Reading, puzzles, number puzzles. I'm not a word puzzle kind of person. Unfortunately, with depression, there's this thing called anhedonia, which is essentially you don't find joy in the things that you used to. Oh, hi there. Yes, I spoke with you as well. There is this thing called anhedonia that often comes with it, where you don't find joy in the things that you used to. Do you have your sax with you? I do. If you guys want to see it, I will happily show it to you. It's not actually with me right now. It's over in the music room. But I can grab it for you in another stream if you want. But anyway, anhedonia. So it's essentially you don't find joy in the things that you used to. So people might say, you know, go and play the video games that you used to, but it's just like the spark isn't there. And that's one of the first things that a lot of people notice about it. So if you do notice that occurring in you, certainly go and see help, because it could be something more. I'm not saying that it is, but it could be. Do you see this crisis as the inevitable biggest psychological experiment on humanity? That's such a good way to look at it. I certainly don't believe that it's the biggest psychological experience. I mean, certainly in recent times, in this part of the world, I would say it is. I mean, there's atrocities happening all over the world, and you know, certainly in other places, I think that they've possibly experienced worse than this. In recent times, though, certainly where I am, definitely. And I think it's really interesting in the people who are able to stay strong through it. Because it seems to be those who were already sort of loners, kind of like often the ones who are depressed, who seem to be getting through it the most. But the extroverts, you know, they seem to be having a bit more trouble. But of course that's a major generalization. I do apologize for that. I'm scanning through streams. You're very sweet. Oh, thank you. You can't feel joy either. How can you overcome it? Therapy doesn't help. Try to notice what fixes your joy. Geez, that's rough. How to get through it. Look, not all forms, there are heaps of different forms of therapy. Like I've tried DBT, CBT. If you have OCD, try CBT. It's great. Talk therapy. I'm actually working on one, internal family systems, at the moment, and this is the first one that I'm finding I'm gelling with. And this is after 11 years of searching. My only suggestion would be just persevere. They are right in, figure out what brings you joy, but I do understand with anhedonia, it can be really, really difficult to find out what does bring you joy. It is really a matter of perseverance, and I am sorry it can take ages to find the right therapist. It can, because you really have to gel with them. It's really a relationship that you want to gel with, and that's if you choose the therapy route. There are other routes. I'm certainly not going to minimize the value of meditation. I've never been good at it, but I know some people are. Spend time. I would really recommend spending time with family and friends if you can, and getting social contact. That's a big thing that I think we can all do, and I know that's really, really difficult. And I am sorry. But that sort of connection, we know that it's really important for humans. We are social animals. We are pack creatures, and social connections it's one of the things that we know is really, really important. And during those times when things are really, really bad, you will need those connections. So, it might be really, really hard work to do it. I completely understand. I mean, I'm often tired after 5 minutes of socializing, but often if you're with the right people, often if it's just a really relaxed environment where you don't really have to expend much effort, that can help. What about cuddle therapy? Definitely. I give you all a hug, please. I'm a big fan of hugs. I know some people aren't. I am. To feel joy, I listen to music and watch some good movies. Yeah, great. I don't really find joy. I find it really hard to concentrate on movies and books at this point. But what I actually do is I will usually watch YouTube or something like that. And just put it on in the background while using a puzzle book or something like that, which I find a little bit more which I find I'm able to connect with a little bit more. I also, admittedly, I love gaming. I'm a bit more into retro games, Legend of Zelda, and I do still like Pokemon. But I do prefer Game Boy, although I did just get the Switch, but with the anhedonia, I'm finding it really, really difficult to focus on. You look like you're made out of drugs. Look, I know that's meant to be nasty, but okay, thank you. You seem really sweet. Oh, thank you. Without makeup. Thank you. I don't know how to put on makeup, and to be honest, I don't care. I think other people look lovely, and I kind of do wish I could. But, my self-esteem's so low that there's nothing anyone else can say that I haven't said to myself. So, who cares? This is very helpful. Oh, thank you. I hope someone else finds joy from it. Stardew Valley. Oh, please tell me more. Send me a personal message because I want to get into that one. I also really want to get into Animal Crossings. The actual reason I got the Switch was for Breath of the Wild, and I played that for about a month non-stop, and that was really good for me because I'm finding it really hard to find joy in anything, but that did really help. Aussie, oi, oi, oi. God loves you. Oh, thank you. That's another thing. Religion. I'm not religious myself, but if you find comfort in it, nothing. Yeah, brilliant, and pursue that. Seems really comfy sitting around in a bathrobe all day. Not exactly what this is about, but okay. You're bipolar. I'm so sorry for that. Any suggestions? Look, they say mindfulness is a really good thing. What I would say, I can only say what's worked for me. I find it really difficult to just sit in a silent room and just try, I don't know what they say, just breathe or something. I can't do that. But one thing that was suggested to me is have something to focus on. So one of the things that we actually did in here was hold a rock, and we didn't have a look at the rock. So they just gave us this stone, and we were told to close our eyes and just feel the stone and think about the stone. And I did find that after a while my mind did wander, but because there was something to focus on, I didn't have to think about those thoughts. And by the end of it, I was really curious, what does this stone actually look like? So, I only lasted about 5 or 10 minutes, but at the end, it was almost like a little reward to see what this stone does look like. For the person who said sitting around in a bathrobe all day, I'm actually studying at the moment. A lot of people in here are studying, and with COVID anyway, a lot of people are working from home. I actually just had a work Zoom meeting the other day, so yeah, we're not exactly sitting around in a bathrobe all day. Antipsychotics marketed to humans, they drain you of nutrients, they are not healthy. Look, I'm not going to comment on that, not my view. If you think that, do some reading. I would really suggest peer-reviewed journal articles are the ones you want to look at. So search NCBI at the end of your searches, because they'll give you some peer-reviewed journal articles. Thank you to share your knowledge. I hope I can help in any way. Stardew Valley, yep. Okay, I will have to look into that. Are you happier now than previously? Look, it's a bit of a hard question to answer. I'm having a really low period at the moment. I would say it's possibly my lowest in the last 10 years, and I am feeling quite hopeless. Look, I don't want to dwell on that. Feel free to message me. I don't want to dwell on that because I know that can be really boring for a lot of people. All I can say is I'm struggling. But thank you. How old are you? Oh, this might surprise some of you. Yesterday, actually, a lovely person said, are you 19 or 50? Whatever. I'm actually 27. You're Romanian. I'm actually Australian. Do you have an eating disorder? Yeah, actually. I've struggled with anorexia nervosa for 14 years. I am not ashamed of it, but it's not the focus of my therapy right now. It certainly is a focus, but the focus, because a lot of people a huge misconception is that it's a choice or that it's about vanity. That was never the case with me. It was a coping mechanism, and it was because of stress that I put on myself during school. In fact, I've never met anyone who did it through vanity. I mean, think about it. Eating is a human need, if not the biggest human need. So to be able to fight against that, and again, it's not a choice to have something that makes you fight against it, to literally cause yourself to starve to death. Clearly, there must be something different in your brain. And a study came out a few years ago which actually showed you're very photogenic. Thank you. I don't think I've ever had anyone say that, so thank you. To be able to fight that natural human instinct, perhaps the greatest human instinct we have, the biggest one of survival, to be able to fight it to the point of starvation, clearly there is something different in your brain that you can't control. And this isn't a choice. I've had this for 14 years. This is absolute living hell. If I could get rid of it, I would give anything to get rid of it. Anything. Because anorexia is such a struggle every single day. And yes, there was a study that came out a few years ago that proved that it is a metabolic condition, that it is a genetic condition, and that there are structural differences in the brains of people with anorexia. So please, that's something that I'm really passionate about. I might do a future stream on it if a few people want it, because there is such a stigma about it and such a misconception about it. But the only thing I want to say is it is not a choice, and it is not about vanity. Sending my biggest of love. Thank you. I send it to you too. Meditation/mindfulness training. I completely agree. But I do also understand that for people with depression and anxiety, mainly depression, and other mental health disorders, but the one I have the most experience with is depression. It's mindfulness. Sometimes there are times, if you're in the midst of a panic attack, for example, where you simply cannot or at least I cannot. It only takes a lot more mental strength to be able to do that. Deserves more views. Oh, thank you. I hope so. Rock and roll. Totally agree, man. 80s rock and roll. That is my jam. That sounded really uncool. Meditation is not for everybody. Completely agree. I know some people have benefited greatly from it. Me, I found it really difficult. I would still really like to get into it though, just from what I've heard. You are awesome. Oh, thank you. You're all really nice. What do you do for work? I am actually a sleep scientist. I'm working nights at the moment. Oh, look, to be honest, the major reason it says scientist is because I have a degree in biomedical science and postgrad in medical statistics. But in terms of the actual job, at the moment, it's mainly been night work. So I set up patients, and then throughout the night, there are some nights where it's downtime. There are some nights where you're just flat off your feet. It's a paradox. I was anorexic for a long time. Anorexics are some of the most driven people. It takes serious drive to commit to starving. It's not a choice though. I didn't know it was happening until a year in. Exactly. Scrambled Eggies. Nice name. I am so sorry for your struggle, because look, anorexia is horrendous. Any eating disorder is horrendous, and my heart goes out to all of you. I am so sorry, because not enough people understand, and look, the treatment for it in most places is still very barbaric. I will actually spend a few minutes going into that, so I do apologize if you're not interested, but I have been tube fed. This was last year. I was actually scheduled under the Mental Health Act into a public hospital, which that's a whole other story. I wasn't given any psychological support while I was there. I was essentially treated like this was a choice. I was treated by people who aren't trained in eating disorder therapy. Again, given no psychological support, even though we know it is a mental illness. I was tube fed for 2 weeks with a nasogastric tube, so it goes so it goes through your nose and down your throat, so it hurts like crazy. Even though my blood tests came back normal after a few days, except for some liver, except for the LFTs, but they were only slightly off. They did ECGs every single day. Okay, fair enough. I wore a heart monitor every day. Again, fair enough. I was on a drip every day. My fluids came up pretty quickly, but the nasogastric tube, I ate everything they put in front of me. I had a nurse within arm's distance for those 14 weeks, day and night. I had someone watch me in the bathroom and the shower, which was absolutely humiliating. I mean, I find it hard enough to undress in front of myself, let alone a complete stranger. And of course they did that to prevent against purging, even though purging has never been in my history. Never. But of course, I'm an eating disorder patient, so I must purge, mustn't I? There's so much generalization placed on anorexics. Nasogastrics don't hurt. Look, maybe it's different for everyone else, but it definitely hurt for me. Going down, once it's actually in there, it was just really, really annoying, like there's something at the back of your throat. But for me, it really, really hurt going down there. I don't know, maybe they didn't place it right, but I was literally coughing up blood for a couple of weeks. Flinders Medical Centre, good. I've actually heard that. I'm not going to name the hospital that I was in, but essentially there were no specialized eating disorder beds. I was actually placed on the cardio gastro ward, mainly for the heart, for heart monitoring, which I mean I understand, but yeah, you're beautiful. Oh, thank you. 30 more pounds and you'd be a supermodel. You really will beat this. That means the world to me. Thank you. That's actually another thing. I feel really, really bad about myself right now because of my weight and because of how I look. I know that I look like crap. I know that, and I can see that every day. After my live stream yesterday, I'm not gonna lie, I cried. I cried because I thought you look awful. But it's something that you really can't control. I'm really, really fighting it at the moment. I really, really am. I'm the most intense Rexy relapse, and I'm terrified of my family finding out, being admitted. Look, I'm not. Please, I'm not saying that admission is a bad thing. If it is, I'm not going to say if it's required, because so many people have said to me, well, it's what was needed. I'm now being treated for trauma because of it. Please, the first thing is open up to your parents, okay? If you're at a stage where you're scared, if you're at a stage where you want help, please reach out, because look, I'm sorry, but most people can't do it alone. And I'm not saying because anorexics or eating disorder patients are weak. By no means is that the case. We're some of the strongest people around to be able to survive this, as is anyone with any mental health disorder. But please seek help, because, even people who have suffered for years, I know what it's like to feel exhausted, just exhausted inside your own head, just exhausted being alive. And I know what it's like to not want to exist anymore. If you're reaching that stage, then what do you have to lose? Really, hold on for another day, hold on for another week, because the alternative, let's not focus on what it will mean for everyone else, but for you, depending on what you believe, for me, I believe that it is the end. If you do believe it is the end, then you have nothing to lose, but you have everything to gain. Again, I know that a lot of people are going to be really, really sick of hearing that, and to be honest, hearing it coming out of my own mouth, I'm kind of really sick of hearing it. Because again, I know what it's like to not want to exist anymore. But you're worth it. You are. Sorry, that went on for way too long. This brings tears to my eyes. Look, if this can help one person, I feel like I have nothing to live for. I'm so sorry. I'm really, really sorry, but it's not true. It's not true. Again, you have everything to live for. Look, I'm going to go on a little bit of a tangent here. When I was in school, I was aiming to become a scientist, preferably in research. When I got that badge saying sleep scientist, it was one of the proudest days of my life. But ultimately, I've realized during the past 10 years that I don't care if I'm a scientist anymore. I don't care what I do for a job anymore. What I want to do is be happy, whatever that means for you. And I know that everyone has a different meaning of life. My meaning of life is to be happy, to feel good for you. Because just be happy. And I know that's so much easier said than done, and I still feel a lot of regret and a lot of hurt thinking about all the years that I've lost to mental illness, to this depression, to this OCD, and especially to this anorexia. I feel a lot of shame, even though I definitely shouldn't, but I definitely feel a huge sense of loss. But it has made me realize that I just want to be happy. That's all I want in life anymore. I just want to be happy. So sorry about that. One day at a time, exactly. Some days it's going to be one step at a time. But sometimes that's all you can focus on, and that's okay. How's the weather today? In this part of Australia, it's actually sunny. Look, to be honest, okay, so it's 2:00 in the afternoon here. To be honest, I actually have what my mum termed the afternoon blues, where I'm actually really, really quite afraid of the afternoon. When I'm depressed, it actually brings forward to the morning, to the point where this morning I didn't even open my curtains until now, because I hate looking at the sky. Even though I'm a distance runner, I'm outside running. But I'm... Yeah, sorry, that's a bit of a tangent, and I know I sound a little bit crazy, but it's actually a little bit difficult sitting beside the curtain right now, but I know that I look even worse when it's artificial light. Anyway, you deserve to be happy. Thank you, and so do all of you. Caveman thinking. I hope you're not. Look, if you mean that I've got caveman thinking, please let me know where I've gone wrong. This is what my depression is like too. Sunlight is unbearable. I'm so sorry. Zelda, yes. What's your favorite game? I like the Oracle games. If you haven't checked them out, check them out. You have a concern regarding your relationship with your extended family. Okay. Look, if you want to message me, go ahead. I'll do my best to help. Yeah, sorry. Definitely message someone. If not me, then someone closer to you. So that's Enri Cloud. I'm so sorry for what you're going through. But certainly, yeah. I don't want to share your story on the stream in case you don't want it shared. So, by all means, if you want to private message me or someone more qualified, then that's good. Is sleep a factor for you? Definitely. As I mentioned, I work those 12-hour night shifts, and I've been doing those hard yards for 3 years. It looks like I'm finally getting into day work, but sleep is a major factor for me. My mental health definitely worsens when I'm lacking in sleep. How much does a sleep scientist make? Look, I don't think it's appropriate. I don't think it's the right place to answer. So I'm sorry about that. You took the dog to the vet today. Oh, I'm sorry. I hope your dog's okay. God, pets, they're family members, aren't they? I'm personally a big fan of guinea pigs. Your voice is very calming. Oh, thank you. Autistic tendencies, male. There is one of my family members is on the spectrum, so I am incredibly. My heart goes out to you because I know how much he struggles with it. Again, as with anorexics, as with anyone with any mental health disorder, you are so strong for getting through it. And please seek help, because there is help out there. And again, you are worth it. I'll go. Look, mate, nothing you can say that I haven't said to myself. Ugly, I know. Hi from Ireland. Hi from Australia. Are you a clinic worker or are you hospitalised? I am hospitalised. This is a voluntary hospital, and it's not a hospital in the sense that a lot of people think it is hospital. But yeah, I am here as a patient. I feel wanting to overshare, but I wish you happiness. Oh, thank you. I wish you happiness too. Yeah, send me a message. What makes you most happy? It's a bit hard to say at the moment. I do apologize for that. For the most part, I do have a really supportive family, and I do actually want to say my mum, she's the strongest, most amazing woman in the world, and I wish she could see that in herself. She literally saved my life. She got me through anorexia, and she's gotten me through depression. She's sat up nights with me while I've been crying. She's sat up when it first began when I was 16. She told me she sat up during the night watching my chest rise and fall just to make sure that it did. She has saved my life, and her hugs are the safest place in the world to me. I wish she could see how amazing she is. And I love her with all my heart. But yeah, all of my family's really supportive. So even during the darkest times, that brings me a lot of strength, and I know that I'm so lucky in having most most of the family be supportive of me. God bless your mum. She is amazing. She actually also fosters native ducks which are injured. She is an animal rescuer. Actually, my nan, she's really amazing too, and she's my mum's mum. They actually grew up with wildlife in their house, just rescuing and taking care of and then releasing sick and injured wildlife. They're the most selfless women I know, and they're both so amazing and so strong. Are the doctors there loonies? Good question. No, they're all amazing, don't get me wrong. They are all absolutely amazing. Some of them do seem to be a little bit crazy, but to be honest, for me, that suits me. Oh, I'm so sorry about your mum. I'm so sorry. Your all-time favourite song? Ooh, nice question. I don't know. It fluctuates all the time. Yeah, I don't know. Right now I'm listening to a lot of Gaslight Anthem. They're pretty cool. ES Posthumous, they have some pretty cool ones. Yeah, it's completely eclectic. What year is it? Look, mate, half the time I forget to. Mental hospitals suck. They do. They really do. Luckily, I'm in a private one at the moment, and it's actually, I'll never be comfortable here, but it's certainly better than the public ones. Your mum sounds amazing. What's a happy memory for you? When I was a kid, we used to have family picnics, and they were really special. I have a lot of memories with my mum from a kid, and one thing I do want to say is that all of my memories from childhood, look, there were some things that weren't so great during my childhood, of course, but the memories that I have are for the most part happy, and the reason for that is my mum. And all my sisters will agree, because she's the most protective mum and the kindest mum and just the most amazing person in every single way. And yeah, she's the reason that my memories of childhood tend to be really, really good. And she's also the reason that I've gotten through depression and anorexia and OCD to this point. Without her, I wouldn't be here. Do they feed you delicious ice cream? Look, me with my eating struggles, I don't know. They do have little ice cream pots I've seen, but I don't know how they are. I went to hospital once and my parents had to get me out. I'm so sorry. I am so sorry. That one of the things that really angers me about the hospital system, certainly here, is that they can force people in, and that's fine. I know that some people, unfortunately, look, if it's a matter of patient safety, making sure they don't hurt themselves or hurt others, then it may be required. But at the end of the day, for so many people, it just causes so much more trauma than it fixes. You've been in the hospital 5 to 6 times. I'm so sorry. You seem like a kind person. Thank you. So do you. So do you all. Most people seem really nice. It's the stupid little cups. Completely agree. I'm in private, so luckily we're allowed mugs. Thank God, because I love my coffee. I think you have to when you're a night worker. How old are you? 27. You talked about happiness is the most important thing for you now. What are things you've done to try to pursue that? Very good question. I don't know, to be honest. I guess at the end of the day, it's just continue to pursue with treatment of depression, and there have been times where I've been forced into that treatment because I've just been so blue, and that's to put it mildly, that I couldn't seek treatment, that I was in a place where I was in a dangerous place. I was in a really dangerous place for myself because I had given up and I was forced forced to pursue that treatment, and in fact coming in here was one of those cases. I've been here 3 weeks now, so I'm feeling a little bit more comfortable, but it's still hard every single day. I had electroconvulsive therapy in 2015. Again, that was a terrifying experience for me, because I didn't know what it was like. My great-grandmother went through it in the 50s, and it really damaged her. But of course it was a lot more barbaric back then. Now they have general anesthetics. They use muscle relaxants so that when the seizure's induced, all you actually see is I believe it's the toe, all you see is the toe shaking. They do it while you're asleep, so they put you under general anesthetic. You're only under for about half an hour. And the only thing afterwards, some people experience memory issues. I experienced a bit of memory issue around the time, but I was so depressed that I didn't want to remember anyway. And a little bit of jaw ache because you naturally clench down. The other thing is that they titrate it. So what that means is they'll start at a really low threshold, and the whole idea is that they give you the minimum dose needed for you to have a chance for you to possibly get better. Although that treatment didn't help me directly, I do believe that the rest that I had during those weeks is the thing that did help me a little bit for a little while. I also had transcranial magnetic stimulation, or TMS, a few years ago, and that's essentially where they apply a magnetic field to a particular part of the brain. You're completely awake during it. I found it quite painful. Again, that treatment didn't directly help me, but I was working at the time, and I really, that month or so where I was able to get my sleep into a bit more of a pattern, that really helped. I've also been on more medications than I can even remember, and some of them have had really massive side effects. But it's all a learning experience. Everyone is a little bit different. If I question this too much, do you have trouble trying to pursue happiness due to being in parts of society like capitalism, etc.? Is there any advice you have to cope? Look, honestly, for me, I'm a little bit ashamed to say that I am a bit of a hermit. Don't get me wrong, I do love spending time with friends, and I do love speaking with friends and family and all of that, but I'm definitely an introvert. So in terms of the wider society, look, certainly with my depression, before when I was back in school, I was certainly, a lot more understanding of what's going on in a global scale. But when you're depressed, you tend to sort of focus really inwards, and you just sort of go into your own shell. So it hasn't really affected me, and I'm sorry, I don't have any tips. You know where to get some. I presume you're talking about the meds. Sorry, here you need a prescription. Sorry about that. I'm sure there are other places you could get it, but I have no idea. You're so damn brave. Thank you. I've just been going through this so much, and I'm so sick of the stigma that I really like talking out. What triggered your depression? Look, I was diagnosed when I was 10. I don't know if there was a specific trigger for it. As I said, I had a really, my mum is amazing. It wasn't really anything to do with my childhood, I don't think. I've since learnt that there were some things in my childhood which have badly affected me, but I wasn't aware of it back then. There wasn't a specific trigger, I don't think, although there was a lot of stress going on in school that year. I was with a teacher who really frightened me, and that definitely triggered my OCD. With the depression though, I've got a huge genetic background. As I said, my great-grandmother, she attempted suicide. There's been certainly other attempts in my family. A lot of depression, a few other mental health issues in my family, so there's a huge genetic component for me. You want to get better, but you don't know how. I'm so sorry. Again, I know that feeling. My biggest suggestion is seek help. There is a lot of help out there. Speak, even if you don't go straight on the route for, straight to psychiatry, straight to counsellor. There are online therapies, if that helps you. There are online therapies. I think they're all probably paid service, but they're going to be a lot cheaper than a therapist, and it's a good way to see if that works for you. But my first point of call would be reach out to those around you, reach out to your family, reach out to your friends, because often they're the ones who are able to give you that help and to give you the resources to get that help. Because I also know that when you're in the deepest, darkest depths of your mental illness, sometimes, even seeking help, it can become this impossible task. So find someone else, find someone close to you, your family or your friends, who they can make the phone calls and they can do what needs to be done, and just leave it up to them, which I know can be a really scary thing, but it can be the first step. For me, it was the first step. Although I was 10 at the time, so I wasn't about to make a GP appointment. You seem like a saint. Thank you. Far from it, but I hope I can help at least one person. What drives you to keep going in life? Look, that's a question that I don't know how to answer. My mum, my nan, thinking about how much it could hurt. I don't know. There are some times when I can't find anything that keeps me going in life. I don't know. But I do believe wholeheartedly that recovery is possible. I'm not going to sit here and say that, that the future is sunshine and rainbows. We all know that's not true, and quite frankly, if you've suffered from mental illness, you've probably heard that a million times before, and it probably, I'm not going to swear, but it probably annoys the hell out of you. So I'm not going to say that, but I do believe that recovery is possible for everyone. I don't know. I believe there are good times ahead, and that you have to, even during your darkest times, if you can at least tell yourself that. You might not believe it, but if you can at least tell yourself that, then it might help. But I do believe that there is help for everyone out there. So again, if you are struggling, please seek that help, because you are worthy. And things don't always have to be so bad. What are your plans for the future when you get better? Firstly, thank you for saying when. Thank you. A quick note on that. I don't know that I'll ever recover, but I do believe that managing it is the end of this road. That I will just have to learn to manage it. What are my plans? I would love to go into further study. My dream before all of this was to get my doctorate and go into research. It means the world to me that that my badge says scientist now, but I would love to go into genetic research. That's what I'd love to do right now. But my plans for the future, look, at this point, again, it's just to be happy, to find some way to be happy in life. I want to pick up my saxophone again and feel that passion that I once did. I want to pick up the pencil and continue drawing like I used to. I just want to find passion in the things that I used to. I guess that's my plan in life. What do you feel when you are running? I feel like I'm on top of the world, and I feel like I'm stronger than I really am. Last year, as I mentioned, and I've actually got a photo, if you look on my profile on Reddit, I put a photo up a few days ago. So last year I was forced into hospital, going into heart failure with the nasogastric tube, and I was there for 2 weeks, and told that I would probably never run again. 3 months later, I ran my half marathon, got my fastest time ever, finally got a sub 90 minute, and finished the second female finisher. It was one of the happiest moments of my life, and I still can't really believe it. So running makes me feel stronger than I am. It also makes me feel like I'm good at something. Unfortunately, these days with the anhedonia, running, the joy of it has been largely lost. But it certainly used to bring me a lot of joy, and I hope that one day it will again. But yeah, the major feeling is that I am strong. You know, when I go out for a 32-kilometer run, it makes me feel strong. It makes me feel like I can do this. And admittedly, it's mainly because of the OCD that I do that. And admittedly, it takes a lot of pig-headedness to do that on very little fuel, and it's not something that I would recommend at all. In fact, look, I'm just going to say it, it's stupid, but at the end of the day, it does make me feel strong. Maybe running can remind you how strong you can be. Thank you. And I also really appreciate that you say how strong you can be, because a lot of people say you are strong for running that distance, but no. What takes strength is recovering from mental illness. What takes strength is recovering from anorexia and recovering from depression. That takes far more strength than running a marathon, than running an ultra marathon. That takes more strength than I think I'm capable of, but I know there are some people out there who do have that strength, and those people, I can't imagine it. They're the strongest people on earth. They really are. Do we know what causes OCD? I'm not versed in the topic, but there is a huge genetic component. For me, there's a huge genetic component. For me, when it began, I was 10 years old, and it began really, really suddenly. I was actually reading the 5th Harry Potter book. Everyone in my school was reading it, and I was really, really anxious to get it finished by the end of the weekend. And I was sitting in bed reading this book. So I know the date, it was the 23rd of July 2003. And I was reading this book, and I got to the end of the first page, and something in my head said, and it wasn't a voice, it was an impulse, kind of like an itch, but it said, read this page again. And I thought, I don't know why this is happening, but okay. So I read the page again, and the impulse went away. I got to the end of the next page, and the impulse was there again. And by this point, I started getting really, really scared, and I started thinking, I'm going insane. I'm going to get institutionalized. From that day on, things have never been the same. And when that first year, I was 10 years old, and suddenly something in my head was telling me to do things that I didn't want to do. It took literally hours from my day, every single day. And to be honest, what pulled me through that year was my mum. She knew what it was immediately, and she got me through it. She lay in bed with me while I was reading that Harry Potter book, even though she hates Harry Potter. And when I got to the end of a page, she would say, okay, you finished the page for the first time? Yes? Okay, we're turning the page. She got me through it. She got me to survive it. Things have never been as bad as they were when I was 11, but they are ramping up now. So they're certainly still not that bad, but they are probably the second worst than they've ever been. But I'm so lucky I've still got my mum and my nan and my family supporting me. I'm really, really lucky in that sense. So, you know, at least I do have that pulling me through. So sorry, anyway, what causes OCD? All I can think of is there is definitely a genetic linkage. I don't know if they've found more than that. But again, they've found that there are actual differences in the brains of people with OCD. Yeah, it's definitely it's definitely a huge thing, and if you do experience it, I am really, really sorry. Heading off to bed. Oh, all right, bye-bye. I'm probably going to go in a little bit too. This has gone for a long time, and I think I'm going to get cut off soon. So yeah, I'm sorry I couldn't answer all of your questions. If you do want to send me a message, please go ahead. I will do my best to respond, but the Wi-Fi is a little bit spotty here, so it might take me a little bit while. I do apologize. The last thing I want to say is, if you do experience a mental illness, any mental illness, you are worthy of help. You are capable of help, and you deserve help, and there is help out there. Please seek help. Reach out to those around you, okay? Because you can be happy and you are deserving of being happy, okay? And also, for all of you who are surviving mental illness, you are the strongest people. You are so much stronger than you feel. I promise you that, all right? Please be kind to yourselves. Take care of yourselves. I hope to do another stream soon. Yeah, just spreading the good vibes. Please take care of yourselves. All right. Thank you all for joining me.